I had to log in on my phone because my computer's not working. Very interesting. Okay, well, morning, I think. All right, so today is, what is it, April 7th, 2022. Time is 11:16 a.m. Apologize for the delay. A little bit of a more technical difficulty. I could not get my computer to connect to the camera or to the mic. So I have to log into my phone, so hopefully it's not too echoey. Or yeah, I'm trying to fix that also, Rebecca. I don't know why this is behaving the way it's behaving. Is that better? I think that's much better. Thank everybody for joining. I don't know why there's a problem, but it is now time to start the update. I'm just going to very quickly talk about the current numbers, COVID numbers in the Pueblo, as well as discuss the next phase that we just entered into 2 days ago, April 5th. But to provide that update, looks like we are continuing to maintain our numbers to allow us to continue into the next phase of our reopening, phase 2, which basically puts us in a position where we are going to have less restrictions, allowing non-tribal family members to come into the Pueblo to visit, and a few other things that are different from the original phase we were in the previous 21 days. But just to give that update, current active cases in the Pueblo it is currently sitting at 2. We had 1 new case yesterday, and that brings us to a total of 222 positive cases since the beginning of the pandemic, with 218 recovered individuals. The case numbers across the state and the country are still maintaining at a low level, and there is still currently a push to get certain populations boosted through vaccinations because of the continued fear that there's going to be an outbreak sometime in the near future, probably sometime around the fall, as it has for the last 2 years. That's what they're expecting. So we're still trying to push people to get vaccinated, those who have not been, and also to have folks get their booster doses as they become eligible. Currently, the most recent eligibility has been set at everybody over the age of 50. Sorry, just a second. What a problem here. Can you still see me? This is really weird. Okay. So, can you, Rebecca, can you provide the update on the vaccination eligibility as I fix my system here? I actually have a slide to present on this. I know you haven't seen it.
Okay.
So it's pretty self-explanatory.
Yeah, so I know that as far as I'm up to date is recently they approved a fourth or additional booster, depending on how you look at it, for folks who are over the age of 50, but also for those who are immunocompromised. You have to correct me if I'm wrong, if it's the general population for over 50, I believe, that is eligible for the fourth shot, basically, or second booster in that case. So if you're over 50 and you got, I think it's Pfizer and possibly Moderna, you'll want to go ahead and plan on getting that additional shot, because what they're trying to do by providing these boosters is in phased availability. So when every 4 or 5 months or so, they're evaluating if it's beneficial for people to have another booster or additional vaccine in order to help maintain that immune response against exposure to the actual COVID-19 virus. So it's really important, as far as maintaining immunity and immune health, to get those boosters. And that way, even if you do still at some point manage to contract the COVID-19 virus, it's less likely for you to have a severe infection, require hospitalization, possible ventilation, and all of those things that have really impacted our world as we see it today. So even though I know that there have been breakthrough cases, we still want to keep those vaccinations on board and updated. I know that there have been breakthrough cases that have been mitigated by the vaccine. They have been not as severe. So, it's really important that we do that. And if you're behind on getting booster, maybe you made an appointment and forgot, or something came up, you didn't have a chance to reschedule, you want to reach out and make that appointment. Or if you have questions, reach out to us, talk to us about it. We want folks to have the best chance against this virus, because it's not over. We don't know what's happening next. We have some ideas. There's a new variant, and that is currently starting to cause some problems in Europe and the UK. So I know that respective government health authorities are keeping an eye on that. They're maintaining the information as far as the numbers and trying to watch how infective it is. But again, we need to see if we can try to stay ahead of this thing and its spread. I don't have my worksheet with me, but you know, we can help you get the appointments for the boosters if you need assistance with that, or you can contact. I believe are they still doing the clinic over at Buffalo Thunder on certain days, or have they closed that? So it's is it Santa Clara Clinic then?
And Santa Fe Indian Hospital.
Yes, in Santa Fe Indian Hospital. Okay. You would call them to make your appointment to get whichever vaccine that you needed to get, whether it be, if we need to go back and start with the initial series if you haven't received them, or go ahead and call and schedule for whichever booster you are needing next. But again, it's for folks, the new one is approved for folks who are 50 and older, and I believe it's general population and those who are immunocompromised. So it's really important that we stay on top of that. Summer's coming. We all want to enjoy the nice weather, and things are getting green. So the worst thing you could do is get sick through the summer. So I'm hoping everyone can get to enjoy the lovely outdoors and stay healthy. Just waiting to see if Troy's able to resolve what's going on over there. Ladies, do you have anything to add?
I haven't. I'm waiting for my computer now to reboot. It's all back. There's a problem. So thank you for that. I don't know if anybody else wants to talk about the actual distribution and talk about the update around that.
Let's see.
This is Raylene Martinez. Good morning, San Ildefonso. What a beautiful day today. We will continue to accept COVID vaccine cards to receive your $60 COVID incentive. You can send a picture of your card or your immunization record showing that you have received 3 boosters if you are 16 and over or 12 and over, and between 5 and 11-year-olds have to show that they have received 2 COVID vaccine shots. So you can provide those cards to the COVID email, which is covid@sanaipueblo.org.
And also just to add that I know some people may have it on their cell phones. So you can also send a picture and text it to 505-252-5986. If you could, please give us a call and let us know when you're planning on coming so we can get the information and ready, and also to make sure that someone is available to here at our office. Thank you.
I don't know if anyone that's watching has comments or questions. If you do, go ahead and enter them into the chat. If you're watching this after the live presentation, you can also enter it into the chat, and we will get back to your questions that you might have. This update we have is that the cases do remain low, and on April 5th we entered into the second phase of reopening, which will last about 21 days as long as the cases remain low. And the expectation is that the Pueblo will open to its new normal on April 26th, which is basically 21 days of phase 2. And hopefully we remain low and we don't have any major outbreaks or major issues with cases that are coming through. I think that One of the biggest things that we need to understand is just because the Pueblo is opening, it does not mean that the pandemic is over. It just means that we're in a position where we have a high enough initial vaccination percentage for the Pueblo, and that is keeping a lot of the spread of the virus under control and keeping a lot of people from getting sick, hospitalized. So we need to keep up with that. Because since the virus is still around and it has not gone away, we have to look at maintaining that protection for the folks and the people who live in Pueblo. So, especially as we're having more people from outside of Pueblo coming in and visiting, vaccinations are still important. Maintaining your gathering sizes to an acceptable level, as what's listed in the executive order, is important. And sorry. Wow. Okay. But since the sound is still bad, if you all want to give your HHS updates based on what needs to be reported going into the next week, you can do so, and I will still try to fix my technical difficulties.
So did you ladies hear the story about the gentleman in I think in Germany who somehow managed to get something like 47 vaccinations? That was kind of interesting. Please don't do that, folks. I know that that our healthcare providers out there are doing a good job at keeping records, and as much as we want you to get all of the boosters and vaccinations you can get, we only want you to get what you need. So I don't know if anyone else saw that story. It was kind of interesting. It was 90, my gosh. Yeah, that's a lot. I think that they're not quite sure what to do with this poor gentleman. I think he's okay. But it was kind of an interesting story, and it just goes to show you that there's always extremes in either direction, and we want to always aim for helpful and accurate healthcare and not to go too overboard. Yeah. So I just thought that was kind of neat, sort of strange anyways.
Yeah, he was getting the vaccinations so that he could get cards, vaccine passport cards, to sell to other people so he can make money. And, we all like entrepreneurs and people that want to make money, but not the expense of taking vaccinations away from other people. One good thing that comes out of it is that obviously the vaccines are safe because he's got 90 of them and he's still alive. There are no issues with him. He doesn't have any reported medical conditions as a result of the vaccination. But again, 90 vaccinations in a period of 2 years is a lot of vaccinations. I do think that, it does help to demonstrate for those people who are worried or concerned about vaccinations, whether they're going to hurt you, harm you, or kill you. This gentleman has shown that that is probably something that you don't have to worry about, because the questions keep coming up. Well, how many shots are we going to have to get? How many boosters are we going to have to go through before we feel that we were safe? Well, he's gotten 90 in 2 years and he's fine. And obviously he hasn't gotten COVID. So that's some good news, but that was very reckless on his part, putting himself in the community. Vaccine passports and making it so they don't have to get vaccinations. So they're actually improving their reporting systems in Germany now because of this. But yeah, I saw that. It's actually pretty interesting. So I do have a chart that I wanted to put up that shows the eligibility for vaccinations across the board for all age groups. My computer just restarted, so I'm hoping I'll be able to log in and show that, because it gives a pretty good visual of who's eligible and when they should get their vaccine boosters, and vaccines in general for those who haven't gotten vaccinated at all. So, you guys will give me a moment. Find more discussion. I'm trying to fix this. The disadvantage of doing live, of course, is that when you have these issues, you don't have the ability to edit and cancel out these quiet time issues that are going to show up later on the live stream playback. But we're getting there. We are still accepting, or we have opened the door to allow folks to start inquiring about and applying for the gym membership program. There were a lot of folks who were expressing interest in the gym membership program before it got set up and ready to go. And just for those who may not have heard, the diabetes program is offering the opportunity to sign up for gym memberships that can, up to a certain amount, the program can pay for individuals who would like to attend and sign up for memberships at either of the Anytime Fitnesses that are local, which are the Espanola Club and the Los Alamos Club. And it's interesting that all those who are expressing interest in the beginning, we still haven't gotten any inquiries or applications for it. So just wanted to put it out there again. You can contact us here over at HHS to discuss your eligibility, allow you to put in an application for consideration for the gym membership program. And hopefully we can get some of you guys down there starting to work out again and getting folks healthy again after they've been sitting around for the past two and a half years because of the pandemic. So contact one of us over here at HHS and we can discuss that possibility of you getting set up for a membership at one of the Anytime Fitness gyms or clubs. I don't know how you want to refer to it as. They call themselves clubs, But some folks call them fitness centers and some folks call them gyms. But whatever you call them, we have that opportunity for you. So contact us. Let's get you set up.
Well, imagine that. Let's see if I can get this up here. Okay, there it is. So there's always confusion for folks who don't necessarily know whether they are eligible for vaccinations or not. And this chart was created uh, by some medical professionals to try to help make it easier to understand when and and where you're eligible for booster shots and original doses of the vaccine. And it's interesting because it also shows the dosage that's being offered for these different age groups and different categories. And so I just kind of wanted to put this up here so that folks can understand it because it breaks it down between those who are immunocompromised and those who are not immunocompromised. And as Rebecca was talking about earlier, um, the third shot, or sorry, the second booster, I should say, is eligible for the general population that are not immune compromised for anyone in the community that's age 50 and up. If after your third dose, 4 months has gone by. So that's the shot that was just recently approved for the general population. So it is only 50 and up. But if you look down the bottom, it talks about immunocompromised individuals. You can actually have up to 5 doses of the Moderna or Pfizer vaccine based on certain medical conditions that you might be living with. Let me remove that banner because you can't see the bottom of this. It also was hiding Victoria's camera view there. So now she's on the screen. But so just to give you a little bit of a bird's eye view of what types of people are eligible for vaccines right now. This is an important thing to understand because we get a lot of questions about, am I eligible? When should I get it? And this breaks it down from the initial dose, the initial series, which is the first and second dose of Moderna and Pfizer, how much time is supposed to go between the doses. And it also puts up there that the next category of individuals that are going to be eligible for vaccination are those who are 6 months to 4 years of age. As to be determined, they're expecting to have that answer for us sometime around the end of April, first part of May. So that is to be determined, and the first one that's expected to be approved is Pfizer. So Moderna is still in the process of trying to get that approval as well. So I don't know if anybody has any questions about this or has any comments about this, but I just wanted to put this up so people are aware because this is what's being talked about, the new round of booster shots. Now, Moderna has put in for approval for individuals 18 years and older to get basically across the board, not immunocompromised. They've put in for approval for that through the FDA, and that is still being evaluated at this time. So you could hear in the news sometime in the near future that but there's going to be eligibility for the entire population 18 and up to get another booster shot. So it'll be in the same category as that 50 and up booster shot, 4 months after your third shot or second booster. So hopefully this helps. This doesn't confuse you anymore. Hopefully it helps to take some of the confusion away, but it kind of gives you a visual. You can look at it and see this is exactly what eligibility there is for the two primary vaccination types, which are recommended by the CDC. So there it is. Oh, getting all the text messages. Is it too loud? How is the volume? Is it really loud right now compared to where it was before? Okay, because that was a weird situation. But does anybody have any questions about this as part of the team, or anybody who is logged on to watch live? Comments? Does this make things clearer, or does it make it clear as mud?
I think this is a great visual for everyone to utilize. I'm probably going to screenshot it later. I wanted to mention that, I know that the situation in China is getting a lot of news coverage as far as things being kind of bad. And I just want to remind folks that the science that we have here in the U.S. and also the science that we're utilizing here in the community is not the same as what they're doing there. So you might see stories or headlines in the news about their vaccines not being quite up to snuff, or them having lockdowns in a lot of their cities. And I don't want folks to get too alarmed about that and think it's going to happen here as well. So I just kind of wanted to put that out there. So far, I think the population altogether in the U.S. is almost 80% have at least one shot, one part of a series, if not more. And so our vaccines that we created have been incredibly effective as far as they can go in this situation. And I just wanted to put that out there to provide a little bit of reassurance, and still also encourage everyone to get as many vaccinations and boosters as are available to them.
Another reason why this is important is because as the Pueblo opens up more and more activities are happening, we are going to have a lot more exposures to people who we don't know their vaccination status. We do not know what their exposures or their COVID safe activities are. So people are going to start becoming a little bit more concerned, especially as you watch the news. But as you remember, it got bad in China in the beginning because of population. It's the most populated country in the world. And so with more people in tighter living quarters and living environments, you're going to have a greater spread of COVID or any respiratory illness for that matter. As we remember, bird flu, swine flu, all those different flus that were going around China years ago, they had outbreaks there because of the sheer numbers, the population that's there. India was the same way. And I'm not saying that it won't happen here, but the spread is going to be a little slower in areas where there's a lot less population, unless there's a lot of travel going on. So we do still want to be careful, still want to be as COVID safe as possible. If you don't know someone's vaccination status and you don't feel comfortable with them being around you, but yet you're having gatherings or get-togethers, wear a mask. You still want to be protected. If you're around elders or individuals who are immunocompromised, wear your mask. Make it important. Make it an important conversation for your family and friends. And if they're going to be coming around your elders, or they're going to be coming around people who have certain medical conditions that put them at high risk, may have the discussion about wearing a mask, because the protection still needs to be there. One of the issues about the world opening up, the country opening up, and even the Pueblo opening up, is that it leaves certain individuals, especially those who are immunocompromised, in vulnerable positions. And so, the low numbers and the low risk is really only focusing on those individuals who get a great benefit from vaccinations. The reason why immunocompromised folks are allowed to get additional doses of the vaccine is because the ones that were given to folks who are not immunocompromised is not as effective in those individuals. So they can get a vaccine booster, and unlike the rest of us where it can last 4 to 5 months, it could last 30, 60, 90 days for those individuals. So that means they're still at great risk. So that is anybody over the age of 65. That's anybody who has one of the comorbidities or underlying conditions as identified by the CDC. Those people are the ones we have to be careful around. So whether we feel like the freedom of having an open Pueblo is great or not, the individuals who are immunocompromised are the ones that are at the greatest risk. So following those COVID safe principles, making it a priority to continue to wear masks and not have large gatherings, and keeping people up to date with their vaccination statuses. That's important because those individuals who are most vulnerable are the ones that are going to suffer the most if you don't do that. So thanks for bringing that up, Rebecca, because it's not commonly discussed in the conversation of the, I don't know if you want to call it the amusement that people find with the news, with all the different types of stories that are coming out that are contrary to what we have here in the United States. But understand that what's happening in other parts of the world is not always what's going to happen here. But we still have to take every precaution necessary when it comes to COVID, because it is unpredictable. There will be other variants. How we respond to and how we are affected by it is going to be determined by how safe we decide that we want to be as a community, whether it's making sure that your family and friends and yourself are vaccinated, but also continuing to be safe around those people who are vulnerable, because it is going to make a difference. We may not have high numbers, 10, 15 cases, but one case can put someone that's immunocompromised at risk. And we want to make sure that we pay attention to that. So anybody have anything on HHS activities that you want to throw out there before we start wrapping it up?
Just a reminder of the walking on Tuesdays and Thursdays at 9 o'clock now. We are not doing it at 2 o'clock. It's 9 a.m. in the morning. So come and join us.
Well, Dawn's not here. She's out of the area right now, but normally she would give her push for the upcoming community health assessment activities that are going on. So again, like we said last week, keep an eye out for announcements about that. We would like to have as much participation as possible so that we can understand the needs of the community, so that we can provide the appropriate services for those who are going to benefit the most. The community health assessment has not been completed. A new one, or updated one, hasn't been completed in about, since 2014, 2015. So the needs of the community are not necessarily known as well as we would like it to be known. So your participation as a community it's important. And so as you start seeing advertisements for meetings, surveys, requests for key informant interviews, whatever participation that's being asked of you, well, we hope that people would find it important enough to participate and give their input, because input from the community is the only way that we're going to know what the community needs. We can't just guess. So I wanted to give a plug for the community health assessment activities that are coming up. Anything from CHR that we want to report other than the screenings? How about SDPI? Anything from Raylene?
It's opening day. Go Yankees. Number 28.
Nice. Victoria, everything from Healthy Kids? Healthy Communities?
Let's see, for the Healthy Kids, I'm conducting the fitness assessments if anybody's interested in coming in. You do have to fill out some paperwork, and it'll take maybe about 20-30 minutes a visit. Depends on how fast how fast the conversation is and stuff like that. So what else? For March, we had 8 participants for the challenge. And now for April, we have 18 participants signed up. So, and that's it.
It's quite a few. Good stuff. What about CDC Foundation? Rebecca, you have anything?
Just trying to keep abreast of information as it comes out, and as in regards to COVID and other health initiatives, as well as trying to help with the community health assessment. Really looking forward to helping make a difference in the community with the feedback that we get from the community health assessment. So I'm looking forward to having everyone participate as much as possible. And let's go Red Sox! Red Sox Nation representing from Boston.
Wow, we're having a war of teams here, but go Dodgers. Anyway, so thank everybody for participating, those who are watching. So those who will watch this later on, there is going to be a gap in between with some silence because of some technical difficulties, but there is some good information that was presented today, especially around COVID and vaccination. So if you watch this later on, don't fast forward too far past the silence, because there is good information. But again, thank you guys for joining us this week, and hopefully we have a better situation with the technology next week. So from HHS and the COVID response team, thank you all, and we'll see you next week.
Go, yeah.